you are welcome back. The next section of the medulla oblongata is at the level of the sensory decussation. This section of the medulla oblongata at the level of the sensory decussation, we're talking about how fibers from those two nuclei lying at the dorsal aspect of the medulla oblongata, they now form this medial lemnisci that I discussed with you before. So when you now take a cross section, at the level of those nuclei, that is what we are going to see. So similar to the section of the medulla oblongata at the open part, anteriorly we are also going to see the pyramids. And each of these pyramids contain the pyramidal tracts. So we have our own pyramidal tract, lying anteriorly like this. And then by the side of this pyramid, you are going to see our inferior olivary complex, the one I discussed before at the level of the open part of the medulla oblongata. You have your medial accessory olivary nucleus. You have your dorsal accessory olivary nucleus together with the inferior or principal olivary nucleus. They form that inferior olivary complex. And so if you now go to the back aspect of the medulla oblongata, you will see when you compare the canal for the fourth ventricle, the size of the fourth ventricle, as compared to the open part. At the open part, you will see that the fourth ventricle is wider. When you now cut the section of the medulla oblongata at the sensory decussation level, the fourth ventricle is narrower. Are you clear? And so you are going to see all those three nuclei that I've discussed before, all this hypoglossal nucleus. Are you clear? Then the dorsal motor nucleus as well as the medial vestibular nucleus. So we are going to see them organized anterior to the ventral, to the ventral aspect of the fourth ventricle. Are you clear? So when you now go behind the fourth ventricle, you are going to see this nuclei of, this proprioception that we discussed before. That means on the medial side, you are going to see what we call the gracile nucleus, the most medial. And then lateral to it, you are going to see the cuneate nucleus. Are you clear? And then the most lateral of these three is what we call the spinal nucleus of the trigeminal nerve and tract, lying lateral to this cuneate nucleus. So just behind each of these corresponding nuclei are the tracts. You are going to see some of the tracts. If you can remember, we discussed about the gracile fasciculus, the most medial, and then you also have the cuneate fasciculus, lateral. And so now this gracile fasciculus, as it is carrying sensation of this fine touch, discrimination touch, vibration sense, and what have you, and proprioception. So the information, those axons, the first order neurons, they now synapse with this from the gracile fasciculus. Those fibers, they end in the gracile nucleus. Are you clear? So that they synapse with the second order neuron. Are you clear? So also that of the cuneate fasciculus, those axons, they now pass into the cuneate nucleus to synapse with the second order neuron. Are you clear? So the second order neuron here of the gracile nucleus of this side passes forward until it now lies anterior to these midline structures, and then it goes to the opposite side. Are you clear? Similarly, the same thing with the fibers from second order neuron from the gracile nucleus. So it now comes forward like that, crisscross anteriorly like that, and then enters into the opposite side. And this is the beginning of the formation of the medial lemniscus. Are you clear? So much so that you have what we call sensory decussation here. And this is what we call internal arcuate fibers. Because these fibers, as they are coming from the gracile and cuneate nuclei, they form an arc within the medulla oblongata. So they form what we call internal arcuate fibers. Here, we're talking about the external arcuate fibers. Are you clear? Good. So we have now seen this forming the crisscrossing of the sensory decussation. So this one now, they ascend up as our medial lemnisci. So similarly, when you now go behind this medial lemniscus, you are going to see our midline structures similar to what we have seen in the upper section. So you are going to see our tectospinal tract lying behind this medial lemniscus formation, and then the most posterior is our medial longitudinal fasciculus. Are you clear? That is it. So just lateral to this internal arcuate fibers, you have set up of our other lemnisci. If you can remember, we discussed about the lateral spinothalamic tract and ventral spinothalamic tract, that is anterior and lateral spinothalamic tract. If you can remember, we said that those tracts, they carry pain, temperature, crude touch, and pressure from the body. Are you clear? So now they ascend up as spinothalamic tract. So as they reach into the medulla oblongata, they ascend up, to form this spinal lemniscus, which now goes into the thalamus. And in between the two tracts, you're also going to see what you call spinotectal tract. Are you clear? So it's believed that all these three are the component of the spinal lemniscus. So that means if you ask the components of the spinal lemniscus, is not only the anterior and the lateral spinothalamic tract, but rather you also include the spinotectal tract. Are you all clear? Fine. So by the lateral side of, of the internal morphology of the medulla oblongata at this level, you're also going to see the dorsal and ventral spinocerebellar tract. Are you clear? So we already know that this spinocerebellar tracts, they are responsible for carrying this unconscious, proprioceptive information that, I've talked before. So I think this is all you people should get to know with regard to, the cross-section of the medulla oblongata at the level of sensory decussation. So we'll also have a break and also rest a little bit before we finally continue.